Let me ask you something. What do you think ancient Egyptians used to treat a brain injury? Prayers? Magic spells? Animal sacrifice? Here is the real answer. And it is going to completely change how you see the ancient world. 3,500 years ago, Egyptian physicians were correctly diagnosing paralysis caused by brain damage. They were performing skull surgery. They were treating clinical depression with behavioral therapy. They were closing wounds with a technique so advanced that European surgeons could not replicate it until the 1800s. They described cancer, performed dental surgery, had a concept of the pulse that predates the Greek discovery by over 1,000 years. And we almost lost all of it, because in 1862, an American antique dealer named Edwin Smith bought a crumbling scroll in an Egyptian market, paying what amounted to pocket change, not knowing he was holding the most important medical document ever discovered. Today, we are opening that scroll. And what is inside will change how you see human history. The year is 1862. Edwin Smith, an American antique dealer living in Luxor, purchases an ancient scroll from a local seller. He pays a modest sum. He assumes it is a religious document. The scroll sits in his personal collection for decades. After his death, his daughter donates it to the New York Historical Society. In 1930, a scholar named James Henry Breasted finally translates it fully, and the academic world falls completely silent. The Edwin Smith Papyrus, written around 1600 BC but believed to copy source texts dating to 3000 BC, is the world's oldest known surgical manual. Not a prayer book, not a myth, a surgical manual. It documents 48 clinical cases in methodical, precise detail. Skull fractures, spinal injuries, dislocated jaws, chest wounds. Each case follows an identical structure that every medical student today would recognize: examination, diagnosis, treatment, prognosis. But here is the detail that truly separates this document from everything else in the ancient world. In 3 separate cases, the Egyptian author writes, and I want you to think about what this means. He writes, "This is a condition I cannot treat." In the ancient world, where medicine and religious magic were almost universally combined, where admitting failure meant losing status and income, this anonymous Egyptian physician wrote the clinical truth. No false cures, no invented rituals, just honest medicine. A review team at Johns Hopkins School of Medicine examined the papyrus in 2014. Their assessment: the descriptions of spinal cord injuries and their neurological consequences are clinically accurate. Accurate enough to serve as teaching material for modern medical students today. A document from 1600 BC that Johns Hopkins calls medically accurate. Let that land for a moment. Now let us talk about the most shocking procedure documented in the ancient Egyptian medical record: trepanation, the surgical opening of the human skull. Egyptian physicians performed trepanation, drilling or cutting into the skull to relieve pressure after traumatic head injuries using a precision metal boring tool. The procedure is documented in texts and confirmed by physical archaeological evidence. We have found the skulls. A 2018 study published in the journal World Neurosurgery examined 50 ancient Egyptian skulls, showing physical evidence of trepanation. Skulls ranging from 3000 BC to 500 BC. And the finding that made the researchers stop and reread their own data: many of these skulls show clear bone regrowth around the surgical site, which means the patients did not just survive the surgery. They lived long enough afterward for their bones to begin healing. We are talking about patients recovering from open skull surgery in ancient Egypt, with no anesthesia, as we know it. No sterile instruments, no antibiotics. The survival rate the study calculated, approximately 60%. I want you to compare that to something. The survival rate for the same trepanation procedure performed by European surgeons in the 1700s was under 30%. Ancient Egyptian surgeons operating 3,000 years earlier had a survival rate double that of 18th century European doctors performing the identical procedure. Read that again. Let it sink in. Here is a fact so strange it sounds like it came from a science fiction novel, but it is completely, rigorously documented. When Egyptian surgeons needed to close a wound after surgery, a gaping incision, a battle injury, they did not have needle and thread available in most field settings. So they used carpenter ants. The procedure: a large ant would be positioned across the wound, its mandibles biting into the skin on both sides simultaneously, pulling the wound edges together. The ant's body was then snapped off. The head remained locked in place, mandibles clenched, holding the wound closed with mechanical precision. Multiple ants used along a wound created what was functionally an ancient biological suture line. This was documented in ancient Egyptian and Indian medical texts. It survived as a living practice in remote communities in South America and rural India well into the 20th century, documented by field physicians who had no knowledge of its ancient origins. In 2006, researchers at the University of Toronto conducted a controlled laboratory test: ant mandible wound closure versus modern surgical skin staples. Their findings, published in the Canadian Journal of Surgery, concluded that the mechanical closure strength of ant mandibles was statistically comparable to modern metal skin staples. The ancient Egyptians invented surgical staples. They just used biology instead of stainless steel. The Edwin Smith Papyrus was not the only ancient Egyptian medical document. In 1872, another scroll was discovered in Luxor, purchased this time by Georg Ebers, a German Egyptologist. The Ebers Papyrus, dated to approximately 1550 BC, is the largest ancient medical document ever found. 110 pages, over 700 documented remedies and procedures. And within its pages is something that changed modern pharmacology. Egyptians used willow bark extract to treat pain, fever, and inflammation. For thousands of years. Constantly. Routinely. In 1897, German chemist Felix Hoffmann isolated the active compound in willow bark, salicylic acid, synthesized it into a stable form, and called it aspirin. It became the most widely used drug in human history. The compound he made famous had been prescribed by Egyptian physicians 400 years before his laboratory existed. But the Ebers Papyrus goes much further than aspirin. Garlic, prescribed for cardiovascular conditions and infection. A 2016 meta-analysis in the Journal of Nutrition confirmed garlic's allicin compound reduces blood pressure and exhibits measurable antibacterial activity. Pomegranate rind, used to eliminate intestinal parasites. Modern parasitologists have confirmed punicalagins in pomegranate rind inhibit intestinal worm activity. Castor oil, prescribed as a laxative and topical treatment, still in clinical use today. Honey, applied to wounds, infections, throat conditions. A 2017 study in Frontiers in Microbiology confirmed honey destroys MRSA, one of the most antibiotic-resistant bacteria known to modern medicine. Modern pharmacological studies have tested the 700 remedies in the Ebers Papyrus. The result: approximately 40% show measurable, confirmable therapeutic value in controlled laboratory conditions. 40% of ancient remedies validated by modern science. That is not superstition. That is empirical medicine practiced 3,500 years before the word empirical existed. A detail that almost nobody discusses about ancient Egyptian medicine: their dentistry. Archaeological evidence from Egyptian skeletal remains, including a jaw fragment dated to approximately 2650 BC, shows clear, unambiguous evidence of dental drilling. A molar with a precision hole bored through it to drain a dental abscess. The bore is not jagged or rough. It is clean, controlled, done with a metal instrument with precision. The ancient Greeks, who are universally credited as the founders of Western medicine, did not have documented dental drilling until approximately 500 BC. The Egyptians were performing the identical procedure 2,000 years earlier. A 2012 study in the Journal of the History of Dentistry examined 3,000 years of Egyptian dental remains and reached a finding that stopped dental historians. Egyptian physicians had a systematic, consistent understanding of tooth decay, dental abscess formation, and, most remarkably, the connection between oral health and systemic illness, including heart disease. The formal medical recognition of the oral cardiac connection in Western medicine happened in the 20th century. Egyptian dentists understood it in 2600 BC. This is the section that surprised me most when I researched this video. And I want you to pay close attention. The Ebers Papyrus contains a clinical description of a condition it describes as, and I am translating directly, heaviness of the heart, sadness that does not lift, withdrawal from people and daily activities, loss of pleasure in things that once brought joy. Every psychiatrist reading that description would recognize it instantly as clinical depression. Now here is what is extraordinary. The Egyptian treatment protocol for this condition was not prayer, was not ritual, was not sacrifice to the gods. It was behavioral intervention. Specifically, regular physical exercise, time spent in natural outdoor environments, structured social engagement with others, and in severe cases, a form of group aromatherapy using fragrant herbs burned in communal settings. Every single one of these approaches has a modern clinical name: physical exercise for depression, behavioral activation therapy. One of the most evidence-supported treatments available today. Time in natural environments, ecotherapy, also called nature-based therapy. Currently recommended by the UK National Health Service. Social engagement, social prescribing. Actively promoted by the World Health Organization as a primary intervention for depression. In 2021, a paper published in the History of Psychiatry journal formally compared ancient Egyptian depression treatments with current WHO guidelines. The conclusion: significant overlap. The Egyptians had arrived at an empirically sound approach to mental illness 3,500 years before modern psychiatry formalized the same methods. They did not have brain chemistry. They did not have neuroscience. They had observation. They watched patients over generations. They recorded what helped. And they found the right answer. Here is the part of this story that I find genuinely painful to think about. The Library of Alexandria held the largest single collection of ancient knowledge in human history: medical texts, mathematical treatises, astronomical observations, agricultural records, scrolls from civilizations across the ancient world. It was destroyed, not in one dramatic fire, but gradually, across centuries. Julius Caesar accidentally burned part of it in 48 BC. The Emperor Aurelian damaged it further in 270 AD. Under Byzantine rule, it was finally dissolved in 391 AD. With it went most of ancient Egyptian medical knowledge. What exists today, the Edwin Smith Papyrus, the Ebers Papyrus, and a handful of smaller fragments, represents the current best estimate of Egyptologists. 3 to 5% of the medical literature ancient Egypt produced across 3,000 years of continuous civilization. 3 to 5%. Think about what that means. If 40% of the remedies we have show confirmed therapeutic value, and there is no scientific reason to think that ratio would not hold across the rest, we may have permanently lost hundreds of effective treatments for diseases that still kill millions of people every year today. We did not inherit Egyptian medical knowledge. We lost it. And we are only now, slowly, rediscovering fragments of what they already knew. I want to leave you with one thought. For most of recorded Western history, we told ourselves a story. That knowledge only flows in one direction. From primitive to advanced, from ignorant to enlightened, from ancient to modern. The Edwin Smith Papyrus does not fit that story. A 60% survival rate for brain surgery 3,000 years before antibiotics does not fit that story. Treating depression with exercise and nature therapy 3,500 years before the WHO recommended the same things does not fit that story. Ant-head surgical staples confirmed equivalent to modern metal staples by the University of Toronto does not fit that story. What these documents reveal is a civilization that looked at the human body with patient, systematic, honest observation for over 3,000 years and found real answers. Not through laboratories or microscopes or clinical trials. Through watching, recording, and passing knowledge forward generation to generation. We did not build on that foundation. We lost it. And perhaps that is the most important lesson here. Not just what the ancient Egyptians knew, but how fragile knowledge is, how easily it disappears, and how much of what we still need to discover may have already been found once before and lost in a fire in Alexandria.